Hello, hello. Welcome back to the Resting Stitches podcast with your favorite neighborhood oral surgeons, Dr. Sarah Harding, and
Dr. Erin Sheffield.
welcome back.
It's good to be back.
Oh, busy getting school started and kids back in the rhythm. I haven't had that happen yet, but we're working on it.
We
How
are
about you?
too. My twins started school a couple weeks ago, and my little one is starting a new school yesterday. And so I was like, this is the perfect day to get all this stuff done. I have like 7 appointments today. So, of course, Mom, I don't feel good. So she stayed home. Next thing I know, she's texting Dad, "Hey, Dad, I stayed home, but I'm feeling better." So
Of course you are.
it's going really well, but we're on appointment 3 or 4 of the day. We're doing just fine.
Yep, we're doing good. She can add a little pep in our step.
That's right. So she may be on to check on us at any point. We'll just have to see, but
Perfect. Well, today, I think we've been talking about some unpopular opinions, some hot takes, some pet peeves that we have, and we thought it'd be fun to share with everybody some of those things. And it's just really funny because it really has allowed us to have a little insight into our own lives. Erin, being the Chat GPT master, is much better about using Chat GPT to do things. Me, on the other hand, very organic over here, just trying to think about it with every distraction in the world surrounding me otherwise. So that's how life is.
yes, that's right. I'm all for giving my life away to AI if it means making my life easier. So they can take over. If they can take over the dishes and some of the other chores, that would be great.
That's what I'm talking about. Yes. And lately, cleaning out the chicken coop because the poop don't scoop itself,
Oh
right?
my gosh.
Yes,
But those
that's what
free
I do.
eggs are so worth it.
Well, we're still getting the cost per egg down from the first one was our $5,000 egg. So now I think we're on egg number 8. So we're really it's coming
I
together.
that is going down fast then. Yeah.
Mhm. Yep.
Well, my first hot take, this is a big thing like on social media and TikTok is a hot take. So that's kind of where we got the inspiration. And I was thinking probably one of my biggest hot takes. I think self-care isn't a bubble bath, it's boundaries.
Check. How often, is that put out there? Because, "Oh, you should just have a bubble bath and a glass of wine and everything will get better." Oh,
It's a
really?
manicure, baby. It's a manicure and shopping.
Yeah, because that's gonna make everything better.
Yeah.
Yeah, I know. But nobody's teaching about boundaries. But let's be honest, that's really what's gonna keep us sane, right? If we can at least get them and hold tight for a little bit, then we can use that. Have you tried?
The boundaries or the manicure or the bubble bath?
Well, yeah, which one is more effective?
Well, I do want to say I do take a bubble bath every once in a while, and I think that can be restoring. I think maybe a manicure or a pedicure is a nice thing to do, and so I'm not like ragging on those, but I think there's just so much more we can be doing, and sometimes that self care, if it's all about retail therapy. That might not help either if you're financially
Mm-mm.
strapped and things like that. Sometimes I think it makes it worse.
Yes.
But I think we're always talking about, like, light the candle, and we're not talking about leaving the toxic job or learning to say no or
Friends that are saying those things and doing those things, right? Because we're like,
exactly.
"Ooh, are you sure? But you worked so hard in your training. Why would you just walk away from that? But you could just hire somebody to take care of your kids. You could just oh, and I should just stay in the toxic job. Great, thanks. That doesn't
Right,
sound like a good idea." So,
right.
that is interesting. Um, I don't know. I'm not very good at self-care. Not the bubble
We already
baths,
talked
not the
about that.
massages, not the boundaries. I'm getting better at boundaries. Here's a little tea for you, though, and this is interesting. I've really been thinking about this a lot lately, in terms of boundaries, and I didn't see it as a boundary or like a boundary inciting thing until like really the last 2 weeks. So when I was in dental school, I started dental school, just finished my business major, which is really helpful in dental school, and was in anatomy, and I was in over my head, right? I'd already, like we talked about a couple podcasts ago, was full on into my imposter syndrome. And so I truly had to let everybody know that I actually was supposed to be there without them knowing that I wasn't supposed to be there. And I was getting up in them every morning and exercising before so that I could get a parking spot,
Wow.
um, and all of that stuff. And so I was exhausted, and I didn't realize I was exhausted. And I remember after the very first test, I got like a 74 or something. I got something. I don't remember. I might have gotten a 69, and I think we got a 5 point curve, and I had just barely passed. And I'm like, oh shit. Now what? Like, is this going to be the rest of dental school? Like, everybody's going to know. They're going to know I'm not supposed to be here. And I remember going because we all had these little study groups with like a second year as like leading it. And I remember sitting in the study group, and all of the sudden, it was almost like I had an out of body experience. Like I was sitting there and I was listening to everybody talk, and I knew that I should know the words that they were using, but I didn't. And I didn't know how to like reply. And this, and like it totally freaked me out. And I was still like functional and doing all the things, but like I couldn't, like my brain just wasn't processing in and out. Like it just wasn't, I don't know. It was really strange. And that happened a couple of times. Like one time I remember going to the store, and I got to the store and I started to have that same feeling. And I got into the store, and I just like was standing there like, I know that I'm supposed to be here. I have no idea why I came here. Like, what sent me here? What am I doing? What do I need? Like, total mind block. And this whole time, like, I always called it like an absence seizure because I almost would have like this, uh, like a little prodrome, you know what I mean? And then like a
Mhm.
little postictal kind of feeling, that like run down kind of feeling.
Mhm.
And it didn't last a long time. Sometimes it lasted longer than others, but it was like it happened a couple times in dental school. And then it happened again when I took over as trauma chief. Like, I woke up in the morning, the day I took over as trauma chief, and like I felt it, and I was like, "Whoa, it's back! I haven't felt this in a long time." And I had told my co-chief about it, and I was like, "Hey, I woke up this morning, and this is what was happening. It's happened before. I just want to let you know, like, if I need to tap out, like, is that okay if I let you know?" And he's like, "Oh, sure, no problem." And so it hasn't happened since. But you know what I realized it was lately? This whole time I thought it was these like absence seizures, sort of like something. Um, I think it was a panic attack.
I was gonna
Mm,
say, sounds like maybe a panic attack.
huh, who knew? But the good thing about it was like when that started happening, I set boundaries for myself. I said, well, um, clearly I'm overdoing it. And so I just need to stop trying to do everything. If studying 3 hours less gets me 2 less points on the test, then that's great. That's fine. Like, I don't need to keep doing this. And, like, it really set me on a path to be able to say no, to not always say yes, to prioritize, like, getting sleep, when I could, and not always being available all the time for everybody.
Right.
And so I have been finding that I go through seasons where I'm a no person, and seasons where I'm a yes person. And so, but that I think was really healthy boundary setting. I didn't know what happened to me, but I think that that's what it was.
Do you
Interesting.
think that going to residency taught you to say no better? I think for
No,
me. No?
no, like saying no was like not, like that was one way to, I don't know,
Oh,
like it
I
was
see
like,
what you mean. I
oh,
mean,
you
like,
don't
yeah,
want these extra
actually
experiences. Oh, you must
right.
not really be interested. Oh, you just want to be a wife and a mother. Oh,
No, I get what you're saying. I agree. We weren't allowed to say no at work. I mean, like, in my personal life, it taught me to say no because I
um,
couldn't say yes. Like, I could almost never
oh
say
yeah,
yes. And so it showed me how easy it is to say no. We always think you have to have an excuse. And I kind of just learned, like, sorry, I can't make it. No, I can't be
yeah,
there. And that's the end. I don't go into the wishy washy
right,
why. And then people can ask me if that's really true or not. Like, it's just
yeah,
thanks so much for inviting me. I won't make it, you know? So for me,
Yeah.
that was good for that reason. Now I have to learn like to purposely say yes. Like, oh, maybe I could say yes that time.
Yeah. Yeah. That's hard.
Okay, my
All
next
right.
one.
Let's see. What you
I
got?
don't know if you're gonna agree with this or not. I'm curious your take. But I think cottage cheese is an unsung hero of protein.
Erin, I've had this like I've just been enamored with cottage cheese lately.
You have?
Yes. Yes, I just have like one of the other moms on Shep's baseball team told me that she's been mixing avocados with cottage cheese, and I started doing it with a little salt and pepper and tahine, and I I love it so much.
I knew we were best friends. I knew it. I knew it. I was kind of
It's
hoping
so
that you would be
good.
like icked out so that, you know, we
No,
could
Spot
have
is
this
definitely icked out by it. Like he's like,
back and forth.
"Oh, I'll buy it for you, but do not open it around me." I'm like, "Ah, come on,
It's
you're from
good
the
on
Midwest."
everything, right? It's just
And it adds like a
like
little sweetness.
have some protein. You're like, you can eat it
Yeah,
with fruit and something sweet. You
yeah,
can make like pudding out of it if you want
yeah.
to. I use it instead of like yogurt. I make like fruit parfaits or, you know,
It's
I add
so
it to
good.
almost everything. Or savory, my favorite thing to do. I am
Yes.
a total chips and salsa person. Choo. Scoop of cottage cheese with your
Oh, that's
salsa.
funny. It doesn't get
It makes it
curdled?
kind of this creamy. No, it's like this
Oh,
creamy protein chips and
uh,
salsa,
look
baby.
at you. It's like the Velveeta and salsa. What is that stuff?
Yeah, it's kind of
It's
like
so
that.
gross. Yeah,
It's
but
delish.
less processed, hopefully.
I am like I consider myself like a cottage cheese influencer because I talk about it so much on Instagram that I have people sending me pictures of them eating cottage cheese. Like I did it because of you. Then I had this
Oh, that's
patient the
funny.
other day
Can we start
who
calling it dollop with Erin? A dollop with Erin.
yes, ma'am. I had this patient that worked at Prairie Farms, which is a dairy. It's evidently that's in Quincy, Illinois.
There you
Um,
go.
and he's like, "Yeah, I'm like the cottage cheese guy." And I was like, "No way." And he said, "If you're nice to me, then I will hook you up." And I was worried I wasn't nice to him because he was kind of like one of those people kind of awake in the middle of the sedation and stuff. But like a week
Yeah.
later, he brought me like
Oh my
this huge
gosh.
stack of. He's like, I don't know what kind you like, so he got me like the small curd and the big curd and the 4% and the 2%. I mean, that was the best.
Okay, so what do you like? What is your favorite?
I don't even know. I don't really discriminate. Probably a
Oh,
full
I like
fat.
small curd, 4%. Yeah.
Yeah,
Full fat,
that's
small curd. That's my jam.
yeah.
Yep.
Well, I'm glad we're aligned on this, Sarah. That
Yeah, I think so too. It's good. You know,
that makes me
we're
smile.
gonna have a revolution, and a revolution of curd
We need
dairy products.
curdle way. Little Miss Muffet
Yeah.
was onto something, wasn't she? I mean, women, especially in our 40s, we need more protein. So add a scoop to anything. It's
That's
magic.
right. So
Okay.
speaking of which, bras. Hate them. Hate them. Hate them. Hate them. Hate them. First thing I do if I come home and I'm wearing a bra, take up the bra, change. I can't handle it. I cannot handle it.
All bras, sports bras, are those included in it?
Well, sports bras are a little bit less irritating if they're like literally not compressive at all.
The non-supportive sports bras.
Yes, I just feel like we are I mean, think about it. If you walk around and you hold your arm up all day, like, do you think you're gonna be developing any, like, support mechanisms for your arm? No, it's gonna atrophy. But here we are trying to push our boobs up to our neck so that everybody can see that we have something there, and that ligament just doesn't get developed, and so
You
stretch, 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 now we have to wear them.
you may be onto something. I saw something about that saying like since we wear bras, we have to wear bras, you know? But
Yeah.
I also saw a lot of National Geographic growing up and they kind of looked like they could have used some bras that are pretty saggy, so
Yeah, but with our
I don't
protein and our
know.
lifting, like, well, we've gotta develop the musculature too.
Yeah, maybe.
So and at the end of the day,
Hmm.
who cares?
If they're a
Who
little saggy,
cares?
I
Who
mean that's
cares?
gosh.
But you know why
Who
I wear
cares?
them? Is because I'm like, "Oh, if I don't wear it, then, like, you'll be able to see, like, the shadow of my nipple
I
in my shirt,"
know,
because after having
but
babies,
nipples
that's
are in
always
right
there.
now.
That's what
Kim
everybody keeps
Kardashian,
saying.
right? Like, she, like, made some Skims that,
Yes.
like, had a built-in nipple, and here I am trying to hide them, and
Right.
she's making billions of dollars off of fake
Yeah,
nipples.
nipple pad, pad nipple. I
Yeah.
know, it doesn't make any sense, but, like, when I try to wear something that's, like, sheer or, like, that thin material, and it's, like, kind of a drape, like a bag dress, you know what I'm talking about?
Mhm.
Like, it's not like an attractive one, it's just like a cone, like, "Boop, boop, doop, boop," like this, and so you're like, "Well, shoot. Guess I have to wear these things."
Shoot. And I hate the sports bra, uh, what's it called? The straight jacket. When you've got, like, the really tight supportive one and you, like, for the life of you
Oh,
can't get it
yes.
off, and then it's sweaty, and so it gets, like, rolled, and you're just, like, caught. Has that
Yeah,
happened to you? And
yeah,
then
and
you're,
then you
like,
get
pulling a
scratches.
muscle trying to get
Yes.
out of it, and sometimes I've
Yes,
had
because already
moments
my
where
shoulder's all jacked up.
I'm, like, stuck, and I'm like, I remember, like, Abe was gone once, and I was caught, and I was, like, calling my 9-year-old, like, "Help me!" And she's like, "What, mom?" And I'm like, "You gotta save me from this bra!"
Well, hopefully that inspired her to never wear one.
Right? And she's, like, at that
Ugh.
age where I should probably I, like, do it I remember getting a training bra about this age, and she's kinda in that stage, but I'm like, "Why
I'm
what
like, I didn't
is a
even
freaking training bra? You
yeah, what do
wear
you
a
gotta
bra to
tr
train you to wear bras? Isn't that the whole
it's so
aren't you
hateful.
learning to wear a bra as wearing a bra? So why do we have to train you to wear a
Yeah, and
bra
I'm
by
kind of
wearing
like
a training bra? I'm, like, so confused
yeah, and
what
I'm
we're
like, "What are you
training
trying to
for.
support with that thing?" Like, there's
What are
nothing to
we
support.
training?
Yeah, we're training you to join this awful thing where we make you wear this tight thing all the time. It's
The
terrible.
patriarchy is
Yeah,
just cinching
I
us in
know.
and
I'm gonna
holding
start
us.
making I think that men should have to wear jock straps all the time because you never know when somebody's gonna kick you right in the nuts. So then we'll see who is gonna stick around with this trend. Nobody, because nobody wants it. That's who.
All right, you heard it here first. We're starting a movement. We'll start burning bras right here on the Resting Stitch face.
And they're so expensive.
I
Ugh.
know, right? That reminds me, I just bought some bras. I have to go pick them up. They had a special order them because I didn't have them in stock. There is this bra shop in Quincy, Illinois, if anyone is anywhere close. It is a dream. You walk in, the lady's like 36C or whatever. I don't know what size I even am. And I'm like, "I don't know." And she's like, "Here, try these on." Try them on. She was like spot on the first time. We're like, "We'll try on a few more just in case." Got the first bra that she gave me. Ordered
What?
them, and, like, 10 minutes, like, the best bra fitting of my life, we are, like, out of there, and now every year well, and you're supposed to, like, get them every year, right? So me, I'm like, "I'm so on the ball, I'm going back every year," and, like, it's, like, 3 years later because I can't keep track of time, and I walk in, and they're just like, "Yep, 36B," or whatever, and I'm like, "Sure," and they're like, "Here you go. It's amazing." But I have to go pick them up. Dang it.
No, at least you have a bra shop. I'm not even sure that I don't even know
I
if that I
know.
would ever I don't know.
You should come. It's worth it.
V
It's worth the drive. It's so
one time
easy.
I went to Vegas and I had a bra fitting because I was like, "Oh, people do this. They do that." And so I did it and they said that I was like a double D. I'm like,
I
"There ain't
know,
no there
right?
ain't" I'm like, "Victoria's Secret, you're just trying" sorry, I don't know if I should
The
say that out loud,
sizing's weird. They're like,
but
"You're
I'm like
either like a 33A or you're like a 30DD or something," and you're like, "What?"
yeah, I'm like, "That doesn't make any sense." And so I was like, "I think this whole thing is a farce to try and get people to be like, I'm a double D."
I mean, look at you. Clearly you are.
Clearly, yeah.
That's the first thing I noticed about you. Okay, my next hot we're both known for being very voluptuous. What can I
You
say?
know?
Our followers are like, "Ah, I guess we've never seen him before. How would we know?" Okay,
Don't mind
my
my boy
next one.
body over here.
My
Alright,
next
no
one.
problem.
So I think the real flex isn't Gucci. It's grocery shopping at 10 a.m. on a Tuesday because you own your schedule.
Oh. I've got mixed feelings on this one. You know why?
'Cause you do grocery shop on Tuesday because 'cause we're both working
Well,
part-time.
now I can, but when I was when I was on active duty and I would take a day of vacation so that I could get some stuff done during the week, like doctor's appointments or like, doing stuff for the kids or whatever it was. I remember I'd go to Costco and the parking lot is slam full. And you sit 10, 15 minutes in the checkout line. And I'm like, what do you people do? Surely you're not all taking vacation today. And it drove me insane. And I think that's a California thing because everybody like works from home and has simple schedules. And I'm like, I don't understand. I don't get it. Anyway, that's my take. But I also don't think that Gucci is the ultimate flex either. I'm like, well, now that I've spent all my money on a purse, I've got nothing to put in my purse. So now I'm just going to carry around this bag and I'm
But
going to like,
everyone's impressed. They're
I
all
don't
so
know.
impressed.
Well, they're not my friends.
I'm
Because
really
I'm
not
like,
into luxury.
I have to hold it in my lap all the time because you can't like hang it up
I
anywhere because somebody's going to drop
know.
something or you can't set it down because like, I don't know. And then you definitely can't take it when you have kids because they're like, oh, look at this worm. I'm going to put it in your purse. And then like you forget about it and then you find it like a week later and it's
Right. Stuff like that makes me the crazy lady. It's like I purposely drive my like beater car around because I know the kids are gonna leave like smashed up Cheetos in the
Ugh.
back. And I know that even if I have my nice car, that there's still gonna be smashed up Cheetos in the back, but instead of being the nice mom, I'm gonna be like that. Ah, my
Oh, you mean like me?
car!
Because I only have one
Is that like
car
you?
and it's
So
like
are you driving the nice car?
I only have the one. And so I bought this Tesla before I was even pregnant with Shep because I was like, well, I'm like 30 something years old and I'm a professional and maybe I can buy a car now. And I don't have kids. So woohoo, here we go. And then boom, 5 months later, pregnant. Yep. That's how that is. And I am the crazy lady, but I've noticed that I've been a little bit lax lately. So it's
I
gotten a
used to
little
be like,
messier.
"Why are people's cars so disgusting?" And now I'm like,
Now you're that girl.
I get it. I keep being lately like, "Why is my car a garbage pit? It's not a garbage pit. It's not a garbage can. Why?
Yeah.
Why
Yeah.
is my other car? Why is my Tesla a
Yeah.
garbage pit too?"
Yeah.
The only one that's not the garbage pit is my dad's Alfa Romeo that I just don't drive very much, so the kids hardly go in there, but gosh.
Yeah. Yeah. Oh, that's
Yeah.
cool. I don't think I've seen that one. I'd like to see it.
Oh,
That's fancy.
yes. It is
My dad has a
fancy.
little a Datsun 240Z that they got like restored or whatever lately, I think. That's like his little pride and joy. It's so cute.
Oh, that's
So,
fun.
yeah. Our dads and cars, they're funny.
I know. My dad was a big car guy.
Did he like do all the work himself? Like was he good at like the
Um,
tinkering?
I think
Like
when
when
he
he was
was
younger, I
younger,
think.
he did some of
Yeah.
that. I think he was just kind of busy when he was older, but he just, when he died, we had a bunch of cars we had to get rid of, figure out what to do with, from like a
Yeah.
Corvette to the Econoline truck thing. I don't know. So,
All right. I've got one. You ready?
yeah.
I don't bathe my kids very often. That's all.
The
Yeah.
horrors. You don't do
Yeah.
the nightly bath time
No, I don't
routine?
even know, and I don't even understand how people like have time to do it. And I'm like, my kids don't stink yet. They will. And I'm hard and fast on it because we all sit here and talk about how our microbiomes and all of this stuff. And here we are putting all of this like detergent and stuff and like scrubbing it off. And you're like, but our bodies are trying to protect us and you just keep scrubbing it off. And so I think that I'm just going to keep protecting it as long as I can. And then once they get stinky, well, we'll reevaluate. But that's my thought. My mother-in-law cannot handle this. It's hysterical. It's a family joke because she's like, so, can I do bath time? We're like, well, they're with you for a week. So they probably just need one, every night. She's got him in the bath. I'm like, well, whatever you do, you do.
I'm kinda like you, I'm not, like, huge on bathing I mean, when they need it, but we don't have, like, a routine, and I'm thinking whenever we're at grandma's, it's always like, "You guys wanna take a bath?" And I always thought it was because she had the fun, huge jetted, like,
Yeah.
90s pool, but maybe it's like a,
I think it's a
"Erin."
thing. Yeah. It's like a thing. It's kind of like how some people only eat their steak well done because when they were growing up, you could never really know how the refrigeration process was, and so you just
Sure. It's
cooked everything.
generational trauma coming
Yeah,
through.
yeah.
Yeah.
That's
Well, yeah, that's interesting. I don't bathe them. I can't imagine spending that much time every night on bedtime routine. By the time we get to bedtime routine, I will have like a boom, 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 we are done. My husband will sometimes linger and he's been doing meditation with us lately. And I'm like, that's
yeah.
so cute. Kiss and goodbye. I'm out. I'm out. I'm getting out of here.
Yeah,
You were in bed and now it's
yeah,
mom time.
yeah.
For sure, but they will get stinky. I'm finally in the stinky kid stage.
Mm,
The only problem with not, like, being really on the ball about it then is that now they're like, "Why do I have to shower?" And
yeah,
they think that showering luckily mine have always been showers rather than big bathers, but
yeah.
they think that showering is like a, "Go stand in hot water and just feel really good." So I'll get out and be like, "Why do you still stink? And why is your hair still dry?" "Oh, I forgot to wash my body." That's the whole point.
Yeah.
That's the whole point. So you
Yeah,
might
it's
wanna
not a
instill those
relaxation
values.
waterfall.
Yeah,
Yeah.
it's just, like sauna time, hot steam shower sauna time.
Well, alright.
Okay, here's one of mine. I'm pretty passionate about this. I think the whole kids snacks for kids sports is ridiculous. When we were teens, playing like state level lacrosse or high school soccer, things like that, maybe it
Mhm.
makes sense to have some hydration, some water, and maybe some oranges. But
Yeah, I loved those
now,
orange slices. Loved them.
right? But like
Yeah.
now it's like my 2-year-old sits there picking daisies in the field and it's like you got to have a 20-ounce Gatorade and not just like oranges around here at least it's like double pack Little Debbie snacks.
Oh, yeah.
And it's
Yeah.
always 5:45 PM, it's dinner time, and so I'm
Mm.
battling I don't wanna, like, make them have a complex and all the other kids are eating it, but then now we don't eat dinner ever because we ate Little Debbie. So, we're
Yeah.
teaching our kids
I know.
to reward
Horrible.
themselves. You, like, walk for 20
I
minutes,
know.
now I get to have dessert
Yeah.
and a
Yeah.
Gatorade, like, it just
And
makes
then
no
it's like
sense
this
to
it's almost like
me.
a competition too, because now everybody has these, like, individually bagged little bags for each player,
Like
and
treat bags.
you're like a jerk if you don't bring them for the siblings also, because you should know better. And
Right.
it's like there's, like, tattoos and pencils and, keychains, and I'm like, "I just really like orange slices."
Right. How come we aren't just like, yay, we moved our bodies and played on a team? Like that
Right.
should be something to celebrate, isn't
Yeah.
it? But now it's like treat, treat, treat. Every time
Yeah.
you exercise, you get a treat. And I just think that's such unhealthy. And the whole dentist in me just like,
Ugh, I
oh.
know.
And I try to push back sometimes. They'll be like the group text of, okay, parents, let's sign up for the treat calendar. And I'll be like, how about we all band together and just do water and apple slices? And it's always
Yeah.
crickets. And then it's like, "Ugh,
But why? Like, it takes so much effort.
why?
I don't know. And maybe that's what maybe you just maybe this is my call to action to sign up as a team mom, because 'cause I'll be like, "Okay, we're gonna do snacks, but our snacks are gonna be apple slices and orange slices."
Right.
Yeah, and that's what we're gonna do. Yeah. Does anybody have any food
Even
allergies to those things? If so, let me know now. Because it's so expensive, and it's time consuming, and it's right.
hard enough to like sign your kid up for these expensive activities. And then again, we're rewarding them
I know.
for oh it's like they ran a marathon, they got to refuel halfway through, and it extends to other things too, like heaven forbid you send your kid to preschool for an hour without a snack. So remember
Oh, yes. Yes.
I
The
send my kids
shame
to
that is
preschool And they had a snack. Everyone has to sign up to bring snack once a month to share. And I remember saying at the orientation, if I want them to have water, do I have to bring any water bottles, or is it okay if you guys just like from a pitcher of water? And they were like, "What? Huh?" They were
It's
so
just
confused. They couldn't answer the question. And I was like, I what? Why are they so confused? And it was even like a couple days later, they're like, we're so sorry. We were so confused. We didn't know what you were asking. No one's ever asked that before. And I'm like, no one's ever
yeah.
thought to drink water before?
Yeah, like, I'm not trying to pass around the communion cup. Everybody gets their own cup, but there's no reason to have individual bottles. I understand that we're not trying to get some, like, fecal oral contamination going here,
Right.
right? But we don't need to have those little tiny individual bottles where they drink half of it and then they dump half of it and then they smash it and
But that was like, holy social pariah. Like, what are you talking about? Water? And then they're like, please, we want to keep it as healthy as we can for the kids. So 100% juice. Unless you can't afford it, then you can do Kool-Aid. But please.
yeah, but make sure you bring it in, like, a really thin micro or really thin plastic bottle that's been heated and cooled, and we're really here for their health.
Mm-hmm.
That's all.
So I don't know.
Thanks.
The dentist in me is just like,
I know.
my
I
kids didn't
know.
even know what juice was until we started preschool. Now they drink it every day.
I
Not
know.
not my
Chef has started
favorite.
asking for Fanta, and I'm like, No." And he's like, "Can we have homemade soda?" And I'm like, "We can't have soda, and we can't have homemade soda." Like, I mean, what kind of alternate universe do you live in? Anyway.
Sorry, kid, your mom's a dentist. You're not getting soda most of the time.
I just have to say this. This is really funny. Lately, Rivers has been asking me, "Mom, it's really mean. Why do you take people's teeth out of them?"
That is mean. That is really
Because he
mean.
hasn't had, like, a cavity, you know what I mean? Or anything, so he doesn't really understand. I'm like, "Well, baby, I don't just take them out for fun. It's because 'cause they're hurting them," and it is so funny, but I kind of maybe I can use this to my
You
advantage, be
need to
like, "Well,
tell them
all
that
of
they
these
want
snacks."
the tooth fairy.
Oh,
That's
I don't
not
wanna do
mean
that.
if you're getting.
Listen,
I
stop.
know, right? I
Then
always
they're gonna be
tell
like,
my patients
"I got a
when
dollar in
they're
their tooth." I'm like, "Oh my gosh, somebody gets, like, $5 and $20."
I
I'm like,
know.
"Here's a quarter."
That's another hot take. Can we just band together? It's kinda like those people that do the cell phone packs for their older kids, like, can we all just not
I
get the
don't know
cell
what that
phones so we don't have
is.
to go there? Can we
Oh,
just
yeah.
promise that Tooth Fairy doesn't go above a dollar?
Yeah.
I pledge allegiance.
Yeah, and that's if you
No.
took out your own molar and you didn't leave
Right.
any roots behind.
Right?
Yeah.
I always tell my patients when they ask me, like, "Ooh, does the tooth fairy come if you pull it out?" I say, "I'm like the reverse tooth fairy. You have to pay me to take it away."
Yeah.
Right?
Yeah. But then I put it under my pillow and
Then
I
we
wait for the
take it. We take all the teeth home and put them under our pillow. On a good full mouth day, you might have like a good $30 to $50. The bed is kind of disgusting, but you know. Oh my
Um,
gosh.
all right, so speaking of tooth
Oh.
things, do you have any other life things you wanna hot take on?
Oh, I feel like my whole life is like a hot take,
No, I know, me
but
too.
we will be here all day. I'm like the soapbox queen, so
Yeah,
we can move on to your more
same.
interesting.
You ready?
Yeah, I'm ready. I'm curious to hear this for sure.
The one thing that gets brought up in my, like, consults and post-op visits the most? Mouthwash. I hate
Oh,
mouthwash.
I do
No,
too.
you cannot use the mouthwash. He's like, "When can I start using the mouthwash?" And I say, "Never." Like, it's you know? And,
Yeah, it's
so
such a
that's I
scam
just
most of the time.
yeah, and I do you know what I compare it to? Just to really drive it home?
Ooh, I wanna hear.
Douching. Yep. Because you know how they say, "Well, you shouldn't douche because you're douching because you have something stinky, and you're trying to do something about that, but all that's doing is masking the actual underlying problem." So I'm like, "It's the same. It's like you're
That's
douching."
brave. That is brave of you to
Mhm.
use the word douche just, like,
Oh,
anywhere, you know?
well, I
I
feel
mean,
like if
you're a
there's
doctor,
that's
so you
like
can get away with it, but
yeah, it's like I also ask people about their bowel movements, which is
you
they're like, "You're"
do?
Yeah, of course I do.
Should I be doing that?
I don't know, I go deep diving and
Why are you
like,
doing that? Is this,
oh,
like,
well,
post-op? Like, "How you
oh,
doing? You
yeah.
having a good" oh, okay.
Mhm.
Wow.
Yeah, yeah, I deep dive on people and nutrition and
You're way more holistic than I are you asking about periods
yeah,
and timing for wisdom teeth and all that? Are
I
you?
do, I do. I did a lot more when I was active duty because I had a lot more
Mm.
of, like, that age range.
Mm.
But yeah. Oh, yeah, because it
Wow.
matters. Yeah.
I'm
But
impressed. I
yes,
don't
so
care enough about
mouthwash.
my patients to ask about their bowel movements or their periods, I
Oh,
guess.
I do, because it's all
You're f
information that gets stacked up in there. Because I talk about probiotics, I talk about prebiotics, I talk about we're gonna give you some antibiotics, and so in order to make sure that that's not, totally messing up your microbiome because and the other thing was when I was active duty, I didn't prescribe antibiotics routinely unless they had a pre-existing infection or it was, like,
right,
some reason intraoperatively that I needed to.
right.
But in private practice, because of all how litigious everything is and people expect it,
Mhm.
I typically I do, and I don't like that. So I always talk about
Mhm.
it. And I'm like,
Mhm.
and especially with people that have an penicillin allergy because I hate clindamycin. And so I always have big discussions with them about it because I talk about the pros and cons and
Yeah.
like, and this is a decision that we need to make together because this antibiotic is, sets you up for lots of other really disgusting things. But
Well, that's one of my pet peeves, and it was a pet peeve enough of mine that I developed this lecture, and I ended up giving it at Amos and a few other places about
oh, I
appropriate
forgot about
antibiotic
that. Yeah, I forgot about that.
prescribing because I like anyone who has a toothache, whether they go to their dentist or their physician, gets like 10 days of amoxicillin. And
Mhm.
there are like no
Mhm.
diagnoses almost requiring antibiotics for
Mm-mm.
dental. So unless you're like swollen, you don't need it.
Right.
But it makes everyone happy. It makes them feel like
Yeah.
you did something
Yeah.
until you have a side effect, until you get
Right.
C. diff or
Yeah.
Stevens-Johnson's or something, and then everyone
Right.
thinks they're allergic to penicillin, and no one actually is. It's like 1% of people are allergic.
Yeah.
And then the whole cross reactivity with cephalexin is like pretty much a
Mhm.
scam all in of itself. And my
Mhm.
nurse every I do 1 dose of Ancef for almost all my patients, and
That's
then
what we
I'm
did in
done.
residency. Yeah.
And
Yeah.
I feel like a
Or
lot
no,
of
we did
that
ampicillin. I take it back. We did
it's
ampicillin.
more for the, anti-inflammatory properties than it is
Right.
for the actual prevention. Because they say you have to give,
Yeah.
like, 30 doses
Oh,
of
wow. Yeah.
antibiotics for third molars before it prevents 1 case. So it's really not helping that much, but so
Right.
I do it for the
Yeah,
anti-inflammatory. They
and I
got
will
it. It's one
say yeah,
time.
and I will say that, like, it's not really anti-inflammatory, but it is like, it reduces the bacterial load,
Mhm.
like, your body is not fighting against everything, and so in that way, I guess it's anti-inflammatory indirectly, right?
Mhm.
That's kind of the way I
Mhm.
describe it.
No, that makes
Um,
sense.
Let me say one thing, I hate mouthwash, but sometimes I'll still do, like, Paradex, which I also don't like, especially more than 10 days, usually more than 7 days, but I always recommend warm saltwater rinses, just a gentle rinse, it's so good for you, everybody.
Yes.
Okay, that's
Yes.
all I got. I just wanted to finish that
Yeah,
little
I
topic
mean,
there
I think
because it's cheap, it's easily accessible, and actually has a lot of really good holistic well-being properties,
sure. Yeah,
antimicrobial, all kinds of things, so and
I
it's
love
not
that.
messing with the pH. It's not wiping out all of the good bacteria along with the bad. It's not like burning your gingiva.
Can you add in that, washing with mouthwash is like rinsing your mouth with lemon juice and expecting not to get cavities? I don't
Right.
know the actual
So,
pH, I don't think it's quite that bad, but, almost every
ugh,
mouthwash on the market is just
ugh,
acid. So we're
yeah.
like, "Acid is what caused cavities, so let's go rinse our mouth out with acid, but at least your breath
Mm,
will smell good for 3 minutes." Such
yeah.
a scam.
It's
We never
such a
even
scam.
talked about mouthwash in dental school. I just started, like I've been railing on it for the past 10 or 15
No,
years
but
on
you
my
always
own.
had your patients like rinse with like half Listerine, half water, right? Like before you start a procedure. I'm like, what kind of crock is
Yeah,
this?
yeah.
Um, Hold on, I'm looking it up. Um, but I just think it's really interesting some of the stuff that comes out, but like some of the stuff that we don't talk about,
Mhm.
like
I also get annoyed by, like, the pre-med guidelines or lack of guidelines for joint replacements. Like the
Oh,
research is like pretty clear that it's not helping, but all the orthopedic surgeons are butthurt if you don't use it. So I don't personally prescribe them ever anymore. And I'm like, if
right.
you want it, you got to get it
Yeah.
from them. But
Yeah. That's
the
always been my
research
thing
doesn't
too.
support it. But
Yeah.
there's so many people are like, I don't want to get sued. I don't want to get sued.
Yeah, and there's like a handful of people like and one of my attendings, his wife had a knee replacement and it got infected. And so there was like obviously a pain body with that. And so that's why it was like really a hot topic in residency because he was like, it doesn't matter what the orthopedic surgeon says, I'm always going to prescribe antibiotics because it was awful. And I get that. You know what I
But
mean? I mean, it
remember
really
also how you have to take 30
right.
antibiotics before it prevents one infection from
Yeah,
wisdom teeth. So is it even helping? Like
right.
the research shows that it's not really doing anything, but there's so much superstition in medicine and
Yes.
things that sound like a good idea aren't always a good idea. I
Yeah.
mean, even antibiotics for implants, clindamycin, they've done studies that show if you do clindamycin, you have a higher chance of implant failure.
That's
So
crazy.
good thing you did antibiotic. I don't know. It's interesting stuff.
Yeah.
Yeah.
All right. Give me a dental one
Let's see what else. Okay, this
or clinical one. Doesn't have to be dental.
You're in California. So
Hmm.
this is maybe more of a question than it's kind of a hot take and it's kind of a question. And California's similar client with Illinois. You know what I'm talking about, right?
Yeah.
Cannabis. So
Yeah.
I tell my patients 3 days. 3 days, no cannabis, 72 hours, stay away. It's going to put you at a higher risk for heart attack and stroke. It's going to make you be awake. And they still just like, oh, I didn't think it mattered.
Yeah, I didn't
I
smoke it. I
didn't
just
think
had a
it
gummy.
mattered, right?
Yeah.
I did it last night as I didn't think it mattered. And I'm like, why do you think I'm just wasting my breath because it's fun to hear myself talk. I like to hear myself
Yeah.
talk. Here we are on a podcast.
Right.
I do, but not really about that. So my pet peeve is that hardly anyone follows the guidelines. And if I
Yeah.
canceled everyone who didn't follow the guidelines, I wouldn't
I
have any
know.
patients.
I
So
know.
what do you do? Are you having better compliance? How are you driving that home? Because I have not figured out a way to really make that clear to
So
people.
I say, I usually will say, these are my recommendations. You're a grown adult and I am not going to babysit you. And so I hope that you follow my recommendations and just realize that a lot of times the sedation medications that we use, are either less effective or you have a paradoxic reaction to the medications. And so, if that's the case, my number one goal for your surgery is your safety. And so, I will wake you up and I'll continue your surgery with you awake because that's the only way that we can do it safely.
And that's a
Um,
threat.
and it's not a threat. It's I'm just here to take care of
I
you.
know,
And
but
so,
I know. I mean
you
that if
know,
you
and
told
people
me
are like,
that, I'd be like, I'm
ooh,
not. Yeah,
but
I'm not.
it like gives them it gives them skin in the game. Like, oh, I can either like have this gummy today or I cannot have this gummy today and I can stay asleep for my whole surgery. And that seems like it would be better. And so it's giving
Mm-hmm.
them an option, like because I'm gonna do whatever I'm gonna do that's gonna be the safest for you. And I'll tell you all
Mm-hmm.
the risks associated with it, but I'm not gonna babysit you. You know, you're an adult. And we're doing informed consent.
Mm-hmm.
You know what I mean? So I don't know. And it's
It's
not like I'm
tough.
testing you before I'm doing your surgery. So it's like I'm
No.
not gonna know. You can lie to me all you want to, which they do all the time too. So
How many times are you like almost done with the procedure and then they're like, ha ha ha, I
um,
smoked on in the parking lot.
yeah, you're like, I know, I can smell it.
I had one guy that must have been vaping in the office, and
Oh gosh, so gross.
I'm like, have you been smoking in here? Like, no, no, it's just my dad out in the car or something. I'm like, then why does it smell
Yeah. No,
really
it's
bad now and it didn't before? And why are you acting really weird all of a sudden?
Ooh, can I speaking of smoking, sorry, this smell is probably one of the grossest. We smell a lot of smells, right? We do smells. And you get pretty used to them. One that I have a really hard time getting used to is when you're taking a tooth out that's had a long-standing full coverage crown, and they were either like they're a smoker now, but even more gross is they were a smoker and they no longer are a smoker, and you take it off and you can still smell the like that that tobacco smell when the crown comes off of the crown comes off of the tooth and the tooth, like the
That's
actual tooth
so
is still there.
specific.
It is like,
I don't know if I've noticed that. I guess I haven't paid attention to their
really?
smoking status compared
Oh
to
my
the
gosh.
crown removal.
Oh my gosh. It is, like, so gross
Oh.
to me, and it's fleeting, you know what I mean? And I expect it, and so it's like it's nothing on the person, right? It's not that
Right.
they weren't, like, brushing or something, but, like, oh
Okay, I
gosh.
have one more.
Alright.
Like you're saying, smells. There's the smells. There's a lot of the sights, things, people always say, I don't know how you can look at people's mouths all day. I'm rarely bothered by that. But the
Yeah.
thing that gets me, that makes me gag more than anything is the denture that doesn't ever get cleaned underneath. And when you can tell what they've been eating for the last week.
Disgusting. Yeah.
Oh, your salad from last week shouldn't still
Yeah.
be there.
I haven't had a lot of denture patients since, like, I just
You
haven't.
haven't? Maybe that's
Mm-mm.
the difference between California and the Midwest. We're like, "Just take it, we don't care anymore." And the Californians
Yeah.
like, "I wanna look good
I
with
don't
my teeth."
know. I don't know.
Oh, that's the worst. And a
It's
lot of
so
times it's
gross.
like, it's not always, I'd love to blame it on dementia, but, a lot of times it's like the nursing home, people that aren't getting good care on their hygiene, but
Mhm.
that's gag fest for me right there.
Yeah. Alright, I'm gonna end it with an inflammatory one. You ready?
Okay, okay,
Just
oh,
just gonna
yes, I love inflammation.
just gonna I'm just gonna throw it in there. Um, my biggest frustration lately has been on these forums of women doctors, and
I know where
something
you're going.
happens. I know, it's a pet peeve. And someone talks about, and like an adverse event that happens while someone is having any sort of dental anything.
The evil
Um,
dentist.
yes. And then it is like this just like burn them down conversation about how, like, I would never let my child be sedated by a dentist, and like, what are these people even doing, and all of this stuff. And they don't discern between dentists and oral surgeons. A lot of these people have rotated on a general surgery, like when they were in, med school or something,
Right.
but haven't been in the OR, really.
They're
And
like
they certainly didn't.
oncologists or
Yeah.
rheumatologists that have, like, no understanding of who we are.
Yeah. And they, in their residencies, they maybe had an oral surgery program, probably not. And so they don't really know what we are, what we do, or our training. And just the awful insults that are thrown out in these messaging things is it's really sad. You know what I mean? Like, in a way of, like, you're an educated person, and instead of educating yourself and having a thoughtful response, you just fuel the fire with this, even without understanding that every single day we're sedating patients in our office. And you and I both have brought in anesthesia providers, whether it's CRNAs or anesthesiologists. And I feel like a lot of times because that's what they're doing, like, they know the patients. The patients are, like, way more deeply sedated than what I would generally do.
Mhm.
And I have a conversation with every single patient before I do surgery, and I say, I call it lights are on, but nobody's home. Because sometimes, I'm going to give you enough medication to make sure you're comfortable, but mostly to make sure that you're safe. And so you may hear me talking, you may hear the drill, but you just don't care, and you probably won't remember much, if anything at all. And so I let you know that just in case you do kind of come to for just a little bit, just know that you'll be numb because I will already have anesthetized all of the sites, and you will be comfortable, and just know that that's okay. But I'm going to keep you safe, and I'm going to keep you comfortable. And if you're not comfortable, you will let me know, and I will make sure that I will keep you comfortable. I'll give you more local anesthesia or additional medication, but it's patient dependent, and every patient is different. And I just want you to know that's a possibility. And that's my spiel. And so
Right.
if you talk about it ahead of time, I don't need you to be so deep that the whole time I'm freaking out about your airway.
Right.
And so I think that in general, and I was talking to an anesthesiologist about this last week. In general, I think that we as a whole, in terms of oral surgeons, are much more cognizant, and safe and, like, worried about that than anybody gives us credit for, and it seems like, oh, even amongst dentists, they're like, "Oh, the oral surgeons are cowboys," you know what I mean? Because
Right.
it is a different type of person that goes to oral surgery residency, but we're just yeah, but, like, it's not and I understand that, but we're not all just, like, cavalier about everything, like, we're really thoughtful and we make recommendations based on what we're seeing clinically. We're not just like sedate them all, you know what I mean? Because it's not a broad brushstroke. And so I
Right.
just get really frustrated by these posts where it's this fear mongering of like, I would never have my child. And you know what? At the end of the day, if you come in and you say, I don't want you to sedate my child, I will say, well, let's look at the teeth, let's look at the x-ray, and let's talk about it
Right.
because sometimes I'm okay with that. You know what I mean? Like,
Oh,
that's
for sure.
fine. And sometimes
It's
I'm
your
like,
choice.
"Ooh." Yeah, and sometimes I'm like, this is gonna be it's gonna be really tough. It's right up on the nerve. It's got a dilacerated root that's hooking around the nerve. It's whatever it is, but I will be very patient specific about it. And I will definitely consider that. But there's some times where I'm just like, "No, I think it's probably good for long-term you know, not having the dental phobia that everybody has,
Yeah,
you know what I
for
mean?
sure. Well, I've made the
So
mistake of wading into the comment section on
of
some
course
of
you have.
those, and you know me, I can't help myself.
Mhm.
Um, and oh my gosh, it's just like the level
Yes.
of vitriol, and you're trying to just explain, and they're like, "There's no way you could ever justify the terrible things you guys do, and you're the only ones that do stuff like this." And I'm like, "But I'm seeing GI is sedating people, and I see ER sedating people,
Nurses
I'm
in the ER
in
sedating people,
yeah, and
yeah.
I'm in the airway.
Yeah.
GI is all the way on the other side, on the back, on the other side. I'm,
Yeah.
like, monitoring the airway, and is it the perfect system? No, but we have such a good rate of safety, better than any other
Yeah.
form of anesthesia because we're so careful, and they've decided that they personally know more than the state societies and the governing boards and the people doing the training, and somehow these rogue people. We had an anesthesiologist where we trained who wouldn't allow us in their anesthesia cases because they didn't think we belonged there, you know? And, oh, okay, that's everyone else is fine. And they
Yeah.
always thought we did such a good job and we're some of the best residents in the hospital, but it's very
Yeah.
frustrating. And I think some of it is the fear mongering. I've learned physicians are terrified of dentists too.
Mhm.
And I see so many comments, like, they go on these physician threads asking for help, and the dental questions, like, someone was like, "The orthodontist wants to put an expander on my 9-year-old, and what a scam. Is it a scam? And sounds so
Yeah.
terrible and so torturous to do that to my child, and I have no idea what to do." And to me, it's like, get the expander. That's a
Yeah.
no-brainer.
And also
No
get
one
a
is
second
trying to
opinion.
scam you for an yeah,
No.
no one's trying to scam you by making your child's teeth fit better in their mouth and have a better airway and all that stuff, you know, but there's
Yeah.
just so
But I
much
understand.
suspicion
Yeah. There's so
and
much
competition
suspicion.
or whatever. It's so frustrating.
Yeah. It's just really interesting. That's been my big thing lately, and I just get so fiery every time I see
I
this because I'm
know.
like, "Why do we have to keep rehashing this?" But I don't know how I mean, what do we do? Like, can we do more education? Can we but really when it comes down to it, what are we doing more of? Our societies are requiring us to do more additional training, pay, like, $5,000 for this O-beam I don't know how much this training and, like, all of these
Yep.
additional CEs, all of this additional stuff, but we're not
Voluntarily.
yeah, but we're not educating the public on the actual safety of how many
Mhm.
procedures have you done this year with no adverse events from the sedation. It is overwhelming the number.
Well,
And
and
so, like, the
there's no
number of
room for us in the OR. Do you want me to come and do every
right,
case in the OR? Because if you
right.
do, you're gonna have to give me 2 rooms a day, you know? Like, the
Yeah,
reality of the volume that we're doing, and the cost,
yeah.
it's just
Yeah, and if
not
you think that
our
if you think
system.
our sedation costs a lot, imagine when we bring in an anesthesiologist and how much they charge per case.
Okay.
Like, if you think it's already a barrier to treatment with the cost of dental procedures, imagine that. The access to care would go significantly down and it would be even more expensive.
Yeah.
And so I think that we as oral surgeons, and especially I think our societies who we like pay all this money to, instead of just requiring us to do more and being like, look, all of our board certified oral surgeons are taking all of these extra steps to maintain safety, which I think is important, right? And continuing to stay up on it. But I think we need to be dead better about educating the public and really like setting the record straight rather than allowing these, because these are pediatricians and these are family practice
Right,
docs
our
that are like
colleagues.
that have patients that then they talk about these things with them.
And they're saying things like they don't even know how to intubate. One mom was saying, I am going to take my own oral airways to have in my pocket because I'm an anesthesiologist just in case. And I like made a comment and she was pretty nice back when I was like,
Yeah.
pretty sure we have those on our cart, but if you want to bring your own, by all means.
Yeah.
I think that's a really good point.
So that's what I got.
Yeah, that's kind of a heavy one, but I agree. I think it would be helpful if people had a little more understanding. Again, back to one of our first episodes. Who are we and what can we do?
Hmm. Oh,
Uh,
here, I'll end on a fun one. How about this? I
Okay.
think this is fun. It's probably not. Um, when you see like calculus on teeth, and let's say you're taking out 1 and 16 and there's calculus on the second molars, and do you clean it?
Heck yes, I do.
I do too. I do a
That's
little
one of my
scaling
favorite.
back
I
there. I
miss
know.
there are a few things like that that I miss from general dentistry. Those like really
Yeah.
big tartar calculus
Like on the
bridges.
mandibular
Like,
incisors, like
yeah,
on the
oh
lingual.
man,
Yes.
so
I will clean those
satisfying.
too if I like if I'm like in the space and I'm like, oh, just gonna go. I like, well, just take my
Everyone
little two formal, which is my favorite instrument.
Everyone misses that buckle of the second molar too, so it's
Mm-hmm.
prime fodder for us. Bang
Mm-hmm.
our perio dreams.
Mm-hmm. Yep.
They can do our surgeries, we can do their cleanings too, right?
Yeah.
Such
Yeah.
rivals.
Yeah. If I can garden avocados and coffee, I can surely garden your gums.
Right, take a hoe to it. And
Uh,
on that, thank you for joining us today on the Resting Stitch Face podcast. If you have liked what you've heard, please like, comment, and share, and we'll catch you next time.
See ya.